Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Brain aneurysms can lurk undetected, threatening to burst without showing any symptoms. And once they do show symptoms, it's often a life or death emergency. Today, we're going to meet a woman who felt the worst headache of her life and lived with it for days before she was finally flown to the University of Kansas Health System. And we'll learn about the less invasive treatment option that doesn't require cutting open the skull. We are joined by Denise Dunham, who was treated for that brain aneurysm just 3 months ago. We're so glad that you're here with us today. How are you feeling?
I'm very blessed by God, and I'm just so thankful that we have this medical technology, because it's a medical miracle.
Well, we're so glad you're here to share your story. We're also joined by Dr. Koji Ebersol. He is back. He is the neurosurgeon who treated Denise without having to do that open brain surgery. Dr. Ebersol is the health system's director of endovascular neurosurgery. Also, glad to have you as always, Dr. Ebersol. I know it's always a thrill for you to be reunited with your patients. You treat them and then they go on with their life. But just 3 months ago, what's it like to now be sitting next to her?
Oh, that's outstanding. That's why we do these things. It is so great that you got your life back and you're in control of it.
Absolutely.
So take us back, Denise, to this really bad headache that you had. Can you describe what it felt like?
Yeah, I was having sexual encounter with my husband, and it was just like all of a sudden, it was just major head pain, and it was just the worst headache I've ever had in my life, and it actually even went down into my neck area a little bit.
So what had you been feeling up until that encounter, though? Was this going on for several days?
No, it was just all of a sudden it hit me, and it hit me hard.
And it had felt like nothing you'd ever felt before?
No, nothing I've ever felt before, and I told my husband immediately, you've got to take me to the emergency room.
So you go to the emergency room. What do you tell them?
So I told him, I said, it feels like I've had the worst headache of my life, and I've had migraines in the past, but not like this. And so he asked, a lot of questions and diagnosed me for a migraine at that time, and gave me medication for vomiting and pain.
But you knew something was different, right?
It was different.
Were you expressing that? And the reason I ask is because there's a lot of people who suffer from migraines, and if they're listening, how did you express yourself to say, this isn't quite that?
Well, I really wasn't sure at that point in time. I wasn't sure enough to ask for a CT scan. But, I knew that my head pain was severe and vomiting, and I needed some relief
so you
at
live
that point.
Yeah, and you live in rural Missouri. So you go to the emergency department. Did they treat the pain? You said they gave you something?
Yes.
And then just sent you home?
Yes.
And you're supposed to check back?
I made an appointment with the doctor to go see him that Monday, which was 4 days later. And it ended up, I continued to have some pain, not severe though, like I had initially had. It was just a pains a little bit here and there. When I stood up over the 4 days, when I would just all of a sudden get up, I would have head pain.
And you went back to work.
And I did. I went back to work for a day, and I'm driving, and when I get there, I'm having some uncomfortable head pain. Just for a few minutes though, it subsides and goes away. And so I continue to work for the day, and it happens when I drive. When I'm driving again, I get home in the afternoon, and the same thing. I get some mild head pain again, but it goes away. It subsides.
So let's go over the timeline. Your first trip to the hospital was on Wednesday. Then on Sunday, you end up back in the same emergency department,
Monday
correct?
morning. Sunday has gotten accelerated and gotten worse, and I've decided, I need to go back to the emergency room.
So when did this go from you thinking, okay, I have a bad headache, to I have an aneurysm? When did you hear that news, and what did you think?
So I just knew that it was in God's hands, and the medical people would know what to do. And
well, this medical people knows what to do quite often. So Dr. Ebersol, take us back to the basics. What is an aneurysm?
So an aneurysm is a weakness on the blood vessel wall. So if you have a weakness and your blood vessel is supposed to be a tube like this, over time you'll get a little swelling, outpouching, and a full-on balloon, like in the picture here. So it's like the inner tube of your bike tire being pooched out. Typically this takes years to happen, and it happens silently, because in the grand scheme of things, aneurysms in the brain are about the size of a pea. And the brain has no pain fibers, no sensory fibers. The brain has no idea that it's there. So brain aneurysms are much more common than you might think. 10 million people in the United States having these things, and the very vast majority will never experience an emergency like Denise.
So did you know how long, could you tell how long she had been living with this once you saw her?
It's impossible to know for sure, but if we extrapolate about the behavior of aneurysms, we have to assume that this thing has been there for a number of years. Because if you follow an aneurysm forward and you take a picture year after year after year, it changes so slowly that you can hardly appreciate a difference unless you look back over 5 or 10 years and say, oh yeah, it's grown a little bit. That's the behavior of most aneurysms. So I have to assume that it's probably been there 10, 15 years before she had this emergency.
Okay, so we use that word lurking. I don't like that word because I could be lurking amongst any of us. Is that true? And they never cause a problem in life?
Importantly, more than 99% of aneurysms will never cause an emergency in somebody's life. So there is an important population of patients that are going about their daily life, caring about all of their activities and doing them well, with the brain aneurysm not even being aware of it, and that is okay.
That's okay. Okay, but then how do you know? Are the headaches, what is supposed to tip you off to know that this is something that is going to cause a major problem?
I agree. This is one of the challenges related to aneurysm management, is that most aneurysms do not cause a chronic symptom. So you are not trying to identify something that makes you say, let me take a picture of the brain because I think an aneurysm might be there. That is extremely low on the list.
And I want you to do that for me. When we were putting this together, I said, I want you to look inside my head. We all do. You know, you want to look. I want to know what the heart looks like and the brain looks like. But that's not a standard screening, I take it,
that's right.
to check your head. So Denise said that her head only hurt when she moved in certain positions. So is the aneurysm then like pushing against it? Tell us kind of what's going on inside the brain.
Yeah. An aneurysm to be big enough to start pushing on things and causing symptoms is a rare entity, fortunately. And Denise's is in the large category, but it would not be considered large enough to be leaning on things. But it had caused bleeding. The brain and its environment is exquisitely sensitive to blood. So as soon as a blood is spilled in the brain, even a small amount, it will be exquisitely irritated with the worst headache you've ever had in your life, involving the whole head, make you sick to your stomach, you're throwing up, and you get a stiff neck. These things are related to the lining of the brain, which covers the brain and continues down into the spinal cord and is exquisitely sensitive to blood. So then when you turn your head in any specific direction, it will irritate all of this pain all over again.
So Dr. Ebersol, not everyone has access to this health system and to you. In this case, Denise is in a rural area. How are doctors supposed to know and recognize that a severe headache may be something more severe like an aneurysm, and then to order that CT scan?
Importantly, in the field of medicine, we're all working on behalf of the patient to try to keep them as safe as possible. From an aneurysm's perspective, headache is one of the top reasons that patients will go seek help in the emergency room. And the very vast majority of them will not be a life-threatening emergency like this. So statistically speaking, the odds are heavily against an aneurysm being the cause. By far and away, it's much more likely that you have a tension headache or you have a migraine headache, common things that do not have an impact on your overall health, although are heavily inconvenient at the time. My best advice is, if you feel that you've had the worst headache in your life, it's sick to your stomach, and you've never felt anything like this, you've got to work with your physicians evaluating you and say, this is not right. So it just feels unnatural.
So is this where a second opinion would come in handy? But again, we're not talking about waiting and getting doctor's appointments and going and see this person and this person. I mean, the clock is ticking. So how are you getting that second opinion in a timely manner when you know something might be wrong?
You know, most of the cases when an aneurysm is causing an emergency, it's more profound a presentation, and the attention becomes escalated early on. Denise's case is unusual because the amount of bleeding that she experienced that we can detect on the CAT scan was importantly small. So small enough that she looked outstanding, that nobody would think that she's facing a life-threatening problem, even though it was there.
So I want to talk about this. You were transported here when you heard that they were going to send you, life flight you, basically in a helicopter into the hands of Dr. Ebersol. What were you thinking?
So I just knew that I needed medical attention right away, that it was serious.
And they call in the helicopter, you know you got to get there quickly.
Yes.
So are you aware of what's coming your way, what's being flown your way ahead of time? We often heard you sometimes know, hey, this patient's coming. How are you preparing, and how are you trying to make some decisions before Denise arrives?
Right. So aneurysms bleed in spurts. So her aneurysm caused an episode 5 days prior to the helicopter coming. Our job is to stop it from causing another event that it's very hard to survive bleeding from an aneurysm more than once. So that is our goal, to confirm the location of the aneurysm, understand its very specific anatomy for something that's only about this big, to figure out how we can close it while keeping the surrounding blood vessels open to protect you from a stroke.
And we have some images of Denise's aneurysm.
Sure.
I want you to talk us through what you're seeing and what kind of the difference between this image.
Yeah, so if you're at home, you may have to look very closely at the screen. I put some arrows on here to help, because typically when you find bleeding on a CAT scan from an aneurysm, it is very obvious, but it's not obvious here. The arrow is pointing to a central location of brightness. That's how blood appears on a CT scan. It's quite localized, a very small amount of blood relative to most aneurysm presentations. The next picture, though, is, I'm sorry, can you back up one time?
Go back, and on the right side?
Exactly. That picture is the same CT scan with dye injected so that the dye lights up the blood vessels, and the arrow is pointing exactly where the blood is, and there's clearly an aneurysm exactly right there.
So you see that picture and you go, it's go time.
No question.
We need to go on this.
No question. We have to secure this.
Okay, so next photo.
So this next picture is a three-dimensional reconstruction of that same CAT scan, and the blow-up box down in the lower right corner shows the aneurysm clearly with the branching vessels coming out. So this preliminary non-invasive imaging is helping us understand what our management options are. So when I see that, I know with a high degree of confidence, I can likely close that with a minimally invasive approach and not have to have the operating room approach. So we prepare the angiography suite, which is where the minimally invasive treatments happen, and the operating room is on standby in case we can't achieve a sufficient treatment.
Well, and you gave Denise 3 treatment options. You present her with these: open brain surgery, minimally invasive coils, and then something called the web. This is kind of what you're explaining. Explain the pros and cons of each briefly, if you can.
Right. Well, typically, it's best to think about these things as 2 major categories of treatment, and they're both important. We use these things together. Classically, aneurysms were treated by open brain surgery because it was the only approach that we had. So you need an incision behind the scalp, you need to make a window in the bone, you need to dissect between the lobes of the brain, get to the level of the aneurysm, and close it with a surgical clip, which is like a miniature clothespin. We have been doing this operation for 50 years. It is an outstanding treatment. It's considered the most durable, most reliable, most flexible treatment that we have. But in contemporary practice, the vast majority of times, aneurysms are no longer treated by this approach because it's also the most invasive way. And so if the body's already under stress, surgery is another stressor. If you can control the problem without adding important new stress to the patient's body, their outcomes are better. So the other class of treatments are the minimally invasive catheter-based treatments. And there's a wide variety nowadays of medical devices that we can utilize to achieve the goal of closing the aneurysm. And the most typical, the one that we've been using for 30 years, are called coils, these little metallic threads that will curl up like a yarn ball inside the aneurysm. And if you put enough coils in there, you will block blood flow from going into the aneurysm. But in modern technology, we have even more efficient ways to achieve this, and that's what the web device is. It's a singular implant that as soon as you deliver it inside of the aneurysm, the blood flow is immediately blocked and the case is finished.
And we're going to show that here in just a moment. Denise, how did you choose? I mean, this is not a menu at a restaurant. You hear Dr. Ebersol come in and say, here are your options. What would you like to do? I mean, Dr. Ebersol, clearly you know what's best, but it's your job to present her with some of these different options and what's best for her, right?
Yeah, I would like to hear how much of that conversation you remember, and if you had thoughts about it.
I do remember it very clearly, you drawing the diagram for me and explaining in detail what my 3 options were. And the web sounded amazing. like it was a no-brainer for me.
You're like, no pun intended, but you're like, that's the one. Dr. Ebersole, we've had you on here talking about patients who have experienced different types of health crisis and certainly aneurysms, but what particularly is what stands out with Denise? What makes her case unique that you want people to really want to stand out as we continue on?
Yeah, to me, it is compelling that she experienced the emergency event, and the presentation was just subtle enough that the life-threatening diagnosis was missed. To me, it's important that patients advocate for their health. If something is not right, you want to be working with the team that you have full confidence and faith in, so that you're working together.
All right. Be sure to ask your questions. I know I have more coming up, but you can use the chat on YouTube or Facebook, or you can email the Medical News Network. Information is right there on your screen. So we have an animation of this device that you use to treat Denise. You mentioned it, the web. Show us what we're seeing. I think that I call it like the marshmallow.
There it is. Yep, that is, believe it or not, a implant about the size of a peanut that's made out of specialized metal that is self-expanding. It comes in a number of different shapes and sizes, and you're trying to find a good match for the aneurysm. So when you deliver the microcatheter to the aneurysm, the device will open up inside of the aneurysm, and it fixates itself to the sides of the wall because it has an outward pressure to it, and the very fine mesh of the metal blocks blood flow from going into the aneurysm, giving the body an excellent chance to heal it.
So how did you know Denise was a really good candidate for this?
Yeah, it comes a lot down to the very specific microanatomy, if you will, of the aneurysm, the three-dimensional configuration of its shape and its relationship to the surrounding blood vessels, and whether or not we have a web device that's appropriately sized that will fit in there nice and snug to close the aneurysm, block blood flow from getting in.
And we have a couple of images from Denise's procedure we want to show, and you walk us through those.
Yeah, this picture, I see two arrows on there. The arrow at the top is pointing to the aneurysm itself, so that unusually shaped outpouching, and then the surrounding vessels coming around the aneurysm. The other arrow is pointing to a catheter system that is allowing us to bring our instruments to this thing. These are greatly magnified. Remember, we're talking about something that's between the size of a pea and a peanut. So the picture on the left is what we were just viewing. Now the picture on the right, you can see that the aneurysm is invisible because the web device is inside of it, blocking blood flow going to it.
So blood flow is then back.
Pardon me?
So then blood flow is back.
Blood flow is going to all of the surrounding vessels, which is obviously key. If you block blood flow going to the vessels, you're going to cause a stroke. But you want to block blood flow to the aneurysm.
What was recovery like for you?
Recovery was still very painful. I still had a lot of head pain, excruciating.
It's been only 3 months, Denise.
Yeah.
Is this pretty, Dr. Ebersole, is that, how long do you
One
typically
thing
see?
that survivors of aneurysmal bleeding all have to experience is this headache that is essentially refractory to medical management. We don't have a medicine that can help with a headache that is just so innate in nature. So we try to help take the edge off, but really if we gave you enough medicines that you don't feel it, you'd be knocked out. So everybody who's fortunate enough to survive this will experience an important headache for weeks until it gets better.
So, and you're about ready to go back to work teaching.
I am. And it lasted, the pain, excruciating pain lasted for about 6 days. And then it really let up, and I was, feeling much, much better after that. So it didn't even last as long as 2
Good.
weeks. So
I'm glad.
I was very blessed.
So you're back to work, back to driving.
Yes.
Any other complications?
No, I feel great.
This could be a really traumatizing experience for people. So we talk about mental health. How are you handling it mentally? Or you said you put all this in God's hands, so you're just moving forward and living life.
Absolutely, yeah. So no, I didn't have any mental problems.
Yeah, I
been very
support that
thankful.
completely. You can't be fortunate enough to survive bleeding from an aneurysm and then hole yourself up and become a couch potato. It's got to be the opposite. You got to live your life to the fullest.
Live your life. I want to talk about something that you actually wanted to point out, because you said this happened during sexual activity. I was telling Dr. Ebersol before the show started that I met a woman this weekend who I was out running errands. We started talking, and she said she'd had a stroke, and before you know it, she was revealing that this aneurysm happened while she was having sex. Is there a correlation?
Yeah. I appreciate that you're willing to share this part of the history, because I think it's very valuable from the general public's understanding of these things. Really, we are not able to scientifically prove that any particular activity has a direct relationship to aneurysm rupturing. Aneurysms, this weakness on the blood vessel wall, will rupture when the wall gets thin enough that it's not strong enough to hold back the pressure. So the underlying mechanism there is years worth of heartbeats leading to wear and tear on the blood vessel wall. 35 million heartbeats a year are going to be thinning this thing out. But for sure, you will hear about patients who had their event during a particular activity when they were exerting themselves, whether it's lifting weights, helping the neighbor move, sexual activity, you name it. These things will trigger the body to have an elevated heart rate, elevated blood pressure, and the aneurysm strength can be exceeded and you get an emergency. But importantly, we think that that aneurysm was going to go any day now, and that activity tipped it over the edge. If you didn't do that thing, then it would have happened 2 days later in your sleep.
Right, and then that would have been it. That would have been it for the most part. Could it?
Yeah, the unpredictable nature about aneurysm bleeding is that the volume of blood, the 30 seconds that it's bleeding, determines more than anything else what the outcome is. Because if it bleeds only a small amount, you can make it to the hospital, have the diagnosis made, and treatment. If it bleeds a lot, even if we secure the aneurysm, we can't reverse the negative effects that the brain has experienced from a large volume, large pressure bleed.
So a type of a stroke of some fashion.
Yeah. Aneurysm bleeding are classified as a hemorrhagic stroke, a bleeding subset of stroke.
Okay, you said it was okay to ask, but you said you're back to driving, you're back to work, and you are back to sex.
Yes.
Okay, good. Like I said, live your life, girl.
I agree.
Life is good.
There you go.
Get that exercise in any way you can. All right, let's get to some questions from our viewers. I want to know, were you ever afraid? When I was speaking with this woman this day, she said she's not back to any activities that can get her heartbeat up. Was there ever a concern that you were going to rupture again? And then I want to ask you if that's ever a concern.
No, I haven't had that feeling. I'm not afraid. But I would like to know, is it possible for the person that's had an aneurysm to have another one?
Importantly, if somebody is fortunate enough to survive an emergency like this, we are going to be connected for the rest of our lives. We are going to make sure that you always feel safe and confident to live your life to the fullest. And that is a pretty meticulous regimen of imaging follow-up. Because remember, we're not really following a symptom to understand what's going on with the blood vessels in the brain. We need to follow with imaging studies. So somebody that does experience an emergency from an aneurysm is statistically more likely than the next person to have a future event. But if you are responsible with your follow-up, which I have no doubt about our connection, we will keep you in the clear.
Well, that's kind of what Jeremy was asking, is that if you're more prone to get them again. He says it's just like winning the very worst lottery ever, pretty much. Jill wants to know, are aneurysms hereditary? Do they run in families? How does family history knowledge
Yes, there's definitely a relationship there. Around 15% of the time, the aneurysm is related to family history. The statistical criteria makes it quite strict, however. If you have an aunt or an uncle or a grandfather that has an aneurysm, it doesn't meet the statistical criteria of a family inheritance. It needs to be two people directly related to each other in the family line that have an aneurysm before you meet that definition. So that would be mother, father, brother, sister, son or daughter of adult age.
So just to be clear, and this is my question, there really is no scan to get ahead of time to know if you're prone to them. Let's say they don't run in the family, to get any sort of pre-scan to find out if you have one lurking. I just don't like that word, something lurking. It's scary.
You got to remember that these things are much more common than you might think. 10 million people have these things. The very vast majority of them, more than 99%, will go their whole lives, no trouble. So if you get a scan, number one, it is a drain on resources to get a scan without an important statistical reason, but it may be that you get information that is not valuable to you, that instead it's more stressful to you. I don't know how to predict a person's response to finding out that they have a tiny aneurysm. That, statistically speaking, their whole life will never cause them problems. But now that they know that they can't live freely,
that would be me. No way.
I agree. Yeah.
Now, you've just changed my mind.
There you go. There you go.
That is one of those things that's better off not knowing, maybe, in some way. Question from Jeremy, does that implant mean that she can't get MRIs anymore? She's always going to trip the metal detector at the airport.
Right. The metals that we use for these things are not enough to have any impact on the metal detector at the airport. And importantly, all of the devices that we implant in the brain for treatment of aneurysms are MRI compatible.
All right. What's the big takeaway, Denise, from your story? What do you want folks listening to know?
You know, just be proactive, like Dr. Eversole said. You know, if you know your symptoms are bad, you know, you just need to explain that. And you know, I looking back, I should have probably had that CT scan that first night and should have asked for it. You know, but not being in the medical profession. You know, I thought, well, maybe this just could be a migraine all of a sudden. Maybe it's because, you know, I missed my high blood pressure medicine for a couple of days and got too active.
And that's a really good takeaway. Should people just ask, hey, can you run a CT scan on me? Like when they go to the emergency department, should they just ask, hey, do you think I need one? Or
I think the symptoms have to be importantly profound to be thinking there's an aneurysm problem. Remember, this is exceptionally rare to begin with, and it doesn't present itself subtly. So Denise's story, she had the worst headache in her life, nausea, vomiting, involved the whole head. It is the aneurysm story, but the statistics were stacked against her. Her excellent ability to rebound from it was stacked against her. Some other details: had a history of migraine in the past, had high blood pressure and wasn't on her medicines that day, and then was doing something that requires important exertion. So from a statistical point of view, they were behind the 8 ball. I'm just very glad we got in front of it.
anything else you want folks to know before we head out?
Yeah, it's a team. You're working with your physicians collectively to keep you on the right path. So you want to be working with people that have the time and interest to listen to your story from a personal perspective. And if you have that type of rapport, I think you will optimize your outcome.
And we did have that rapport, and I'm so thankful for you and your team.
Oh, thank you.
We can tell. Nice to see you both sitting here today. Always great to have you explain things so that I can understand them.
Good.
Appreciate that. Denise, thank you for sharing your story.
Thank you.
Be well and have a good school year with your kids.
Looking forward to it.
Thank you to all of our viewers for being with us today. We'll see you back here on Wednesday. Coming up Wednesday on Open Mics with Dr. Stites. She's in her 40s, but doctors say Becky Ryberg has the lungs of an 85-year-old, and it's all due to her genetics. I'm Jessica Lovell on the next Open Mics with Dr. Stites, the genetic condition that hurts the lungs but may not show symptoms until middle age. We explore the key signs of the condition and what it means for Becky's kids. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.